afternoon to one and all. I am Dr. S. Jayaraman. I am a secretary of Academy of Medical Specialties. Shortly, we'll start the meeting at 3 p.m. I request all the delegates kindly type your name, email ID, registered mobile number, and TNM's registration number for the CMA credit points. Thank you. Good afternoon. Welcome to all the IMA leaders and delegates and members of our IMA. Very good afternoon. Welcome to all. This is a special event today from the Indian Medical Association, Academy of Medical Specialties, Tamil Nadu State Branch. Today is a special day. We are going to inauguration of the fellowship course in laparoscopy and Lapima. That is IMA Laproscopy webinar today. So I welcome everyone for this special program. This is the program to commemorate the inauguration of our special IMA course this year, 2024. They are going to start from June 1st onwards. So Lapima 2024. So this is the brief course invitation and module. This is the application form. I request everyone. I'll send in all our groups. Kindly download and so fill and join those interested in this course. So this is the course brief detail. We have two stalwarts from Gateway Clinics, Coimbatore, all well-renowned laparoscopic surgeons. They are going to discuss in detail about all the tips and all. So this is the program agenda. The meeting starts with the prayer. Dr. Sendil Kumar for the physician prayer and IMA prayer.
Yes, sir. Very good evening. Physician prayer. Dear Lord, though great physician, I kneel before thee. Since every good and perfect gift must come from thee, I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to my heart. Give me the singleness of purpose, sense to at least a part of the burden of my suffering fellow men, and true realization of the rare privilege that is mine. Take from my heart all the
mic closer, Sendil.
Take this, sir. Take from my heart all the ill and worldliness. That's the simple faith of a child I rely on thee. IMA prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Thank you, sir.
Thank you, Sendil. May I request our chairman of IMA AMS TNSB, Dr. Rajesh Babu sir. Rajesh Babu sir is a senior consultant neurosurgeon and head of the department in Ganga Hospital, Coimbatore. Rajesh Babu sir is a former president of IMA Coimbatore and chairman of Organ Donation Committee of IMA TNSB. Over to Dr. Rajesh Babu sir for the welcome address.
Good afternoon, everyone. I welcome our President, Dr. Abul Hassan sir, our President-elect, Dr. Senguttuvan sir, Dr. Gunasegaran sir, the National Vice President, and the past President, Dr. Sendamil Pari sir, and the President-elect, Dr. Sridhar sir. And I also welcome the State Secretary, Dr. Karthik Prabhu sir, and our Treasurer, Dr. Gauri Shankar sir. And I also welcome the national leaders, the Navita Gupta madam, and also the Srirang Akbari sir for joining this program. Today, we are going to have the inauguration of our IMA AMS the courses, Lapima course. This is the Lapima course is the Laparoscopic Indian Medical Association course. We have conducted the last 2 years, and this year in 2024 we are going to come out with the Lapima course of 2024, which is being conducted by the Gateway Hospital of Coimbatore. And in this course, it will be conducted for 6 months from June onwards, and the flyer will be published in the WhatsApp groups and also in our time of bulletin. And the course fee is actually 50,000 plus GST 9,000, 59,000. And for the qualification is the person should be a qualified general surgeon. they are eligible, and they should have a master degree, and they are only eligible. And those who are undergoing the MS General Surgery also can join the course. These are all the rules and regulations. Regarding the other activities which we are having in our IMA AMS are, we are going to have the IMA State East Zone Conference at Trichy on 22nd of June, and the National South Zone IMA AMS Conference on 4th of August 2024. I welcome you all for the program, and I welcome you all once again. Thank you.
May I welcome our State President, Dr. K.M. Abul Hassan, sir, for the inaugural speech as well as the presidential address. Over to Dr. Abul Hassan, sir.
Thank you, Dr. Jayaraman, Dr. Rajesh and Sendil of AMS, and good afternoon to all the faculties and office bearers and delegates. My dear respected President-elect, Dr. Singleton, National Vice President, Dr. Gunasegaran, our IMA TNSB Secretary, Dr. Karthik Prabhu, Finance Secretary, Dr. Gauri Shankar, the National AMS Office Bearer, Dr. Namita and Dr. Sriyang Akbari, and Gateway Clinics, Dr. Sendil and Piyush Patwa, and all the delegates once again. I am very happy today to inaugurate this lab course in AMS for two reasons. One is, I am very happy that IMA AMS, Tamil Nadu State branch is evolving to another stage of conducting courses, that is skill courses. This is very, very important. I think this kind of skill courses only will be relevant in the maybe in the years down the line. All other courses, maybe the CME courses and all, may be effective only for a few years' time. After that, people will like to come. The reason is that I started this lab course in 2013-14 as a AMS secretary in Tamil Nadu AMS wing in Erode. It was a huge success. We were simultaneously conducting endoscopy course also. Dr. Sendil Kumar would remember, he also came as a faculty for this course 10 years ago. After this gap of 10 years, we are starting it again, so that we are, going to another stage of pulling people to IMA AMS. It is kind of exciting. The thing I have seen the curriculum of this course and also faculty. Definitely, this will be very, very attractive. People will be joining huge number in the years to come. So I wish all the delegates who will join this course and wish them all success in their career, and also wish AMS wing of our own state for putting lots of efforts to bring glory and fame to not only the IMA Tamil Nadu State Branch and also the entire profession. Thank you very much, and I'm very happy to inaugurate this course today, and thank you for the opportunity. Over to you, Dr. Jayaraman.
Thank you, President sir, for his wonderful president's address. Definitely will follow all your advice, and activity will do nicely, sir. Thank you very much, sir. So now I'll give my report, my secretary report. So we do every month, first Thursday of every month, we do the regular webinar program with the TNMC credit points. And we have done so far 3 master class, sleep master class, and vaccination master class. And this month we are planning to do one tobacco cessation clinic master class also. So we do regular programs in various places, academic as well as non-academic program. So our IMA headquarters, this is all the courses available for our IMA members. So starting from the A to Z, we have almost all the departments. They have 6 months to 1 year online, offline courses and all. As per the IMA headquarters, we are going to implement in all the multi-specialty and super specialty hospitals for our own members' benefit. So these are all the courses which are also we are going to plan. So any course you want to start, we have to get the approval from the IMA headquarters, Hyderabad and National IMA. You have to write the letter and stating that the training modules we have to prepare, and along with the timing of training, and which kind of technical details, everything we have to send to the IMA headquarters for approval and for the fellowship course and all. So this is a brief course guidelines. Already our chairman Rajesh Babu sir mentioned about that. Eligibility is the IMA member. They should be IMA member and IMA AMS member. They have to finish the particular concerned specialty. Only they can enter into this course and all. There is a course fee. We have examination also, theory and practical examinations. So this is our team of IMA AMS. Myself, Dr. Jayaraman. My chairman is Dr. Rajesh Babu sir, and our joint secretary, Dr. Adar Sindhil Kumar sir. So any queries about anything, please please feel to call us, and we will explain everything about the course details and other getting approval from everything and all. So with that, I thank you very much. We are going to have the next month the East Zone Conference of IMA AMS at Trichy on June 22nd, prior to the our State Council meeting on 23rd. 22nd evening, we are going to have the East Zone Conference of IMA AMS. Welcome everyone. And August 4th, we are planning to conduct the IMA National Conference of AMS South Zone. So we are going to get the final confirmation dates from our Abgari sir, IMA AMS Honorary Secretary. Sir, another 2 minutes, sir will be speaking about that. So with that, I thank you very much. We'll go on to the felicitation by leaders of national and state leaders. May I request National Vice President Dr. R. Gunaseran sir for the felicitation. Gunaseran sir.
Yes, good afternoon. Good afternoon, everybody. Respected State President Dr. Abul Hasan, Dr. Senkatuvan, Dr. Sridhar, President-elects, and Secretary Karthik Prabhu and Gauri, the Treasurer. The Chairman of IMA AMS Tamil Nadu Chapter, Dr. Rajesh Babu, Secretary Dr. Jayaraman, the IMA AMS Headquarters Secretary Dr. Srirang Akbari, the faculty members Dr. Sendil Kumar and team from Gateway Hospital, and all the office bearers of IMA Tamil Nadu State, and also the faculty members attending today. It is a great opportunity to the surgeons, especially the general surgeons, to learn about the laparoscopy, because every patient coming to them for any problem with abdomen, they want to deal with only through laparoscopy. That's why every surgeon should have the knowledge of laparoscopic surgery. Hereafter, we cannot do a regular open surgeries for many of the illness. So this is a time to learn the laparoscopic techniques. Already, as Dr. Abul Hasan told, few years ago, the laparoscopy and the endoscopy program has been conducted at Erode by IMA Tamil Nadu AMS, and it was done wonderfully. And also, many people benefited out of this. Lapima being inaugurated by the IMA AMS Tamil Nadu chapter by Dr. Rajesh and Dr. Jayaraman, taking good forward step. I congratulate them and wish all the success for the program. Thank you.
Thank you very much, sir. Thank you, sir. May I request our IMA AMS headquarters chairman, Dr. Nomita Sugupta ma'am. I think ma'am is traveling abroad. So may I request IMA AMS Honorary Secretary, Dr. Srirang Akbari sir. Oh, to Akbari sir.
Everybody, am I audible?
Yes, sir. Audible,
Yes,
sir.
sir.
Welcome,
Good afternoon, everybody. Respected Dr. Guneshekaran sir, National Vice President. Dr. Nomita ma'am, she's traveling, so may not have been able to join. President of IMA Tamil Nadu, the President-elect sir, Abul Hasan sir, and Dr. P. Senkatuvan sir, and Secretary Dr. Karthik Prabhu sir, and Chairman of IMA AMS, Dr. Rajesh Babu sir, and Dr. Jayaraman sir, the Dynamic Secretary of Tamil Nadu IMAS. I'm very happy that Tamil Nadu State Branch of IMA AMS, which is a very vibrant branch, conducts so many programs. The only thing which was pending was the IMA AMS courses, and now these courses are starting. I had the opportunity to interact with Dr. Abul Hasan sir during the NatCon, and then he assured that we will start, and then today is a very good day that we are starting the courses. I think this will be in the first of many courses which will be started. We have also submitted modules for the upper GI and lower GI endoscopy course and diabetic retinopathy course. and I'm sure it will be spread throughout the state, and a lot of medical graduates who have completed their training can actually utilize the expertise of experts in acquiring more skills. So I wish this course a huge success, and any help from our side, from the IMA AMS headquarters, we're always ready. Thank you once again.
Thank you, Abgari sir, for your wonderful advice. Definitely, we'll start all the courses in all the hospitals in IMA state branches. Sir. Thank you very much, sir. Thank you, sir. May I request our IMA State Honorary Secretary, Dr. S. Karthik Prabhu, sir.
Leaders of IMA Tamil Nadu, IMA headquarters, and AMS, good evening, everybody. Sir, first of all, I would like to congratulate AMS because the very purpose of AMS is to enable the specialists to get particular training in their area of specialty. And very rightly, the course started today is going to be useful for many surgeons and laparoscopic surgeons. Because when CGP works for the general practitioners, AMS works for the specialists to get upskill their training skills. Such programs and many such programs are the need of the hour, and very rightly you have started it. I congratulate everybody and also today's speakers, and best wishes, Team AMS. Thanks for the opportunity. Best wishes, sir.
Thank you, Karthik Prabhu, sir. May I request Dr. S. Gauri Singh, sir, our State Finance Secretary. Gauri Singh, sir.
Good afternoon, sir. Thank you for the opportunity. Most respected President Dr. Abdul sir, and all state leaders and national leaders and office bearers of AMS, as our secretary said. So the main objective of our AMS is to help the specialists. So that has been not done so far, and you have taken a very wonderful step to go forward. So this should be the milestone of our Tamil Nadu AMS. So this is done by our present dynamic chairman, Dr. Rajesh Prabhu, and dynamic secretary, Dr. Jayaraman sir. So best wishes and congratulations for you. You will have to do more such courses in future. Thank you for the opportunity, sir.
Thank you, Gauri sir. May I request our immediate past president of IMA TNSB, Dr. T. Sendamil Paris, sir. I think sir is traveling, I believe. Anyway, may I request IMA TNSB President-elect 2024, Dr. P. Sengutuvan, sir. Sengutuvan, sir.
Yes. Good evening to everybody. Respected President Dr. Abdul Azam, Honorary Secretary Dr. Karthik Prabhu, Finance Secretary Dr. Gauri Shankar, National Vice President Dr. Gunasekaran, President-elect Sridhar, IMA AMS Chairman Dr. Rajesh Babu, Secretary Jayaraman, and the speakers of the day, It is a very good opportunity. I am very much happy that AMS is entering the program of fellowship courses, first of its kind. I congratulate the AMS Chairman and Secretary for taking efforts to enter the AMS into the specialty courses. I congratulate all the AMS office bearers for their continuous effort, and I wish the program is a good success, and they must engage in very few courses to become. Thank you for the opportunity. Thanks to over to Dr. Jayaraman.
Thank you, Sengutuvan, sir. We will follow all your advice, sir. May I request Dr. B. Sridhar, sir, IMA TNSB President-elect 2025. Sridhar, sir. I think sir is traveling. Anyway, so I thank you all the leaders for your wonderful advice, and the definitely we'll follow all your advice for our members' benefit, and ultimately we are helping the patient. So thank you very much. With this, we'll move on to the CME program. May I request our Joint Secretary of IMA AMS, Sendil Kumar, sir, please take over and start the CME program. Sendil, sir. Dr. Sendil Kumar.
Yes, sir. I want to share this screen, sir.
Yeah, I'll stop share screen. You please take over.
Hello.
Yes, sir.
Am I audible?
Audible, sir?
Yeah. First of all, I thank the entire office bearer of IMA AMS team for giving us the opportunity to do this course. First of all, our sincere thanks to the entire IMA AMS team, because I feel this is an honor to us to conduct this program. Already we have done on LAP IMA program, which went on very successfully. And now we are having this, we are planning this course at Gateway Clinics. Myself and Dr. Piyush extends our sincere thanks for giving us this opportunity. First of all, why this course? That is the main thing. Can I slides happen?
I'm very happy to introduce our friend Dr. K. Sendil Kumar. He's a consultant gastroenterologist and laparoscopic surgeon, Gateway Clinics, Coimbatore. He did his MBBS and MS from Coimbatore Medical College Hospital, and he has the foreign degrees from our GEM Hospital. He has very good exposure of working in international healthcare institutions like Mount Sinai Medical Center, New York, USA. So many awards he has received and recognized as a most renowned surgeon in Coimbatore and the Western regions of Tamil Nadu. He has given various presentations and publications and articles in national and international conferences. His affiliations with various associations like ASI and JES and AWRSC. He is the founder member of the Association of Minimal Access Surgeons of India. He has participated in many live laparoscopy surgeries workshops at the national-wide. He has successfully made world records for 2 major surgeries, such as in the Limca book and so many other records book. We welcome Dr. Sendil Kumar sir, who is a renowned surgeon in Coimbatore area. He worked with me in Coimbatore Medical College. He is known to the western part of the Tamil Nadu. Welcome you, Sendil sir.
IMA AMS team for giving us this opportunity, and myself and Dr. Piyush feel honored. Feel honored to do this program. Already we have done a program with IMA, which went on very well. The lap IMA we have done, and it went on very well. And again, we are getting the opportunity, and we feel honored to conduct this course. First of all, why this sort of courses? So nowadays, a lot of teaching materials are available online, and it is not very difficult to learn. Have a meeting like this, what IMA is planning. It is a meeting with small groups, maybe around 10 surgeons at a time. So the advantage is the doctors, the surgeons who are coming for the training can come inside the operation theater. They are not seeing now only the operation, the surgery aspect. They are able to see the entire set of how the theater is organized, what are the infrastructure needed, how the things are sterilized, and the instrument, how the surgeon is standing, how the assistant surgeon is standing, and the instruments and everything. They can interact with staff nurse, and they can even train their OT nurses. So there are so many advantages of having this closed group meeting, where only few surgeons are participating, and they can come into the operation theater and see by person what are the things which is happening in the center, which is already doing all major advanced procedures. So that is the advantage of having this program, where surgeons can come, they can assist, they can introduce trocar, they can do 5 steps of dissection. So that is the main advantage of having this program. And at Gateway Clinics, we have all the facilities to train all the surgeons in doing basic and advanced laparoscopic surgeries, and we also have access to endoscopy, both the diagnostic and therapeutic, so they can get some exposure in the diagnostic as well as therapeutic exposure. Endoscopy also. That is again another advantage. So we have 2 operation theaters with all high definition systems and 4K systems, and we have all advanced equipments like latest equipments, energy sources, everything we are having. So that will give some exposure, the infrastructure which is needed for conducting any sort of procedure. That will so we have got all the basic and advanced energy sources. So that will give more exposure for the surgeons who are coming and visiting our center. So we are planning to invite faculty from various centers also. Now we have got a lot of connection with the experts in this field of laparoscopic surgery throughout India and abroad. So we are planning to involve each and every surgeon, the authority in the field of each and every field, so that they can have exposure with other centers from India and abroad also. That's what we are planning during this course. And we also teach our staff. We are happy to say that our infection rate, whatever may be the post-site infection and mesh infection, our rate is almost zero, or we can say proudly say that is infection rate is nil in our center. So that is important part of any laparoscopic surgery program. So they should come and see how the instruments are cleaned, how the instrument basic thing in laparoscopy is cleaning of the instrument, because these are all the instruments which we are going to reuse in a different patient. So they should come and visit to see how the instruments are mechanically cleaned before putting into the sterilization setup. So these are all the advantages of having these sort of courses where the surgeon can come inside and they can see the setup, how it is functioning, how the surgeon is standing, how the assistant is standing. So they will have a better orientation while they are attempting for a procedure on their own. So that is the main advantage. So for that purpose, I should be confident that we will be able to offer good knowledge to the surgeons who are coming and visiting our center. I will show one or two surgeries what we are doing it brief this one, because I want the surgeons who are coming to us and visiting us, we can show the way of entry, the way of dissection, and how to respect tissues and how to reduce the inflammation by avoiding trauma to the tissues. So these are all the things in any basic laparoscopy. The advantage of any laparoscopic surgery is least trauma to the patient, so that the recovery is fast. And this is a case of fundoplication, which we are doing it for surgeons. So this sort of the high quality image and the high quality equipments what we are having, and the team which we are having, the both medics and paramedics, the surgical team, we have got 4 surgeons working with us and 2 gynecologists. So with this, we will be able to give all GI exposure as well as gynec exposure to the surgeons who are attending this meeting. So definitely this exposure, we assure that it will give the best possible knowledge to the surgeons who are attending, and they will try to pool more number of cases, and they will demonstrate more and more procedures for the benefit of surgeons who are doing who are attending this course. So this is our aim of doing this conference, and I again sincerely thank the entire IMA AMS team for honoring us by giving this opportunity to participate in this LAP IMA course. So I thank very sincerely once again. Thank you very much.
Thank you, sir. Jairam sir, take on.
Hello.
Yes, sir. Thank you very much, sir. Jairam sir.
Yes, sir. Yes, sir.
Yes, sir.
Yes, Sendil Kumar. Yes, sir. Please, sir.
Sir, next topic, sir.
Yes, sir. Thank you very much. And once again, I thank the entire team for again giving us the opportunity to do this program. And we have got all the, already since we have done the first course earlier, we have done the base for conducting this second course, that we will do in our best way, so that it will be beneficial for us and to the delegates who are attending the course.
Thank you very much, Dr. Sendil Kumar, sir. Now we'll go to the next topic, sir. Importance of need of the laparoscopic endoscopy training in an institution by Cyril sir, Dr. Pais Patwa. Welcome our next speaker, Dr. Pais Patwa. Is the consultant gastroenterologist laparoscopic surgeon, endoscopist in Gateway Clinics, Coimbatore. He is the life member of various association and is the gold medalist in the exit exam of fellowship of India and gastroenterological surgery, head at E-Road. And he was recognized with more awards, and he got the first prize for the best faculty video presentation on laparoscopic management of diaphragmatic hernia in the ASICAN 2018 held at Chennai. His various achievements at his young age in the field of surgery and social service in the form of dedication towards the poor and needy patients. And his surgery has been recognized on the world level as a record. Heaviest ovarian cancer tumor successfully removed by an Indian team of doctors. This extra feat has been recognized and published by the Limca Book of Records and so many other records he has produced. We welcome our Dr. Piyush Paswa to this webinar. Welcome, sir.
So much. Thank you for the invitation, sir. And it is a privilege to attend this particular program and invited as a faculty. I'm thankful to Dr. K.M. Abul Hassan, sir, Dr. Karthik Prabhu, sir, Dr. Jayaraman S, sir, Dr. Gunashekaran, Dr. Sendamil Pari, Dr. Sengatuvan, Dr. Sridhar, and Dr. Adar Sendil Kumar, sir. And first and foremost, who always help us here, Dr. Rajesh Babu, sir, because he motivates every time in any odd hour he's here, and he motivates us to learn and teach every time. So my sincere thanks to Rajesh Babu, sir, also. And in case if I have not named any IMA AMS or office bearer, my sincere thanks. So my topic of today is importance and need of laparoscopy, endoscopy training in institution. Yes, this is very important because the time has come when the era has changed. The era has changed from open surgery to laparoscopy, and it's still going to more minimally invasive surgery. So now everybody in the society, from patient perspective and relatives perspective, they want always a minimal invasive surgery. They always demand it. So if you are unable to do that, probably they search for the next best option nearby. And that is why there is demand increased in the surgeons fraternity to learn a quality laparoscopy and endoscopy. And as a surgeon, Sendil sir always says that a surgeon who is doing good laparoscopy must learn endoscopy as well. So anytime you are in a trouble, for example, you have done some anastomosis, bowel anastomosis, and there is some internal bleeding where the anastomosis was done. For example, gastrojejunostomy. You always have an opportunity to put your endoscope in and control the bleed if in case you know the endoscopy. And that's why the aim of our newer laparoscopic training has been to ensure trainees that they are armed with basic laparoscopic and endoscopic skills, and especially the hand-eye coordination, which is little difficult in cases of laparoscopy. The depth perception, which is again a new problem when you switch yourself from open to laparoscopy and entering into the laparoscopic operating theater, where you have armamentarium of different instrumentations, which is absolutely different from open surgeries, which is usually being taught, seen during our post-graduation. Nowadays, being DNB there in the multi-specialty corporate hospitals, they are exposed to laparoscopy and robotics and endoscopy, but still after finishing of 3 years of post-graduation, there is always need of doing something better and learning something better. And that is why the point of training at an institute comes. So well-designed training courses can provide learner with the tools, techniques, and knowledge which is necessary to succeed in their chosen laparoscopic and endoscopic field, so that they can compete with all the surgeons in their territory, and they can deliver the best to their patients. And this can also be achieved through a combination of theoretical and practical learning, which we always give here. As Sendil sir said, that we invite various faculties from in and around Coimbatore and also from internationally also. So during our conferences, we involve all our trainees who got trained here. Last time also, Rajesh Babu sir had given us opportunity to conduct Endo IMA, which included 6 months of training, where almost 9 delegates from various parts of Tamil Nadu got trained with us. And now we are very happy to give our feedback to IMA AMS that with their this first step to train all the surgeons, that all those 9 trainees who got trained here in gateway clinics for their endoscopy training, which includes upper and lower GI endoscopy, they all are doing very good now. They have all started doing upper GI endoscopies. They have bought their own instruments, and they've slowly started doing therapeutic as well after doing few cases of diagnostic endoscopies. The second thing is this can achieve through a combination of theoretical and practical learning. Theoretical, we take classes morely in the morning sessions, which starts at 8:30 and which lasts till the lunch hour, which is 1:30 p.m. And then after lunch break, we usually start our practical session, wherein we invite all our delegates who have enrolled in IMA AMS training classes, and we invite them to OT Insight, wherein they can observe, they can wash, and they can perform with us, so that they get very close look of basic and advanced laparoscopy. So it is very important in life as per se that when you tackle lot of difficulty, the simple things start looking very simple and they are easy to tackle as well. So we expose them to very difficult cases also. I would like just to show this one of the case. For example, this was a case of leiomyoma in a young male patient where he was suffering with the complaints of dysphagia and discomfort in the chest, wherein we did endoscopy at our own center. And this was done when our trainees from IMA were also there. We do the barium meal study at the same center, and we find that there are areas of dysphagia, and then we do endoscopic ultrasound where we can find a lesion which is there in the muscular layer of the esophagus, and at the same time we can do CT or MRI of the thorax. And that is the advantage in an institute. When a trainee is there, he can go through all the material which are available, he can get through all the diagnostic areas, and then finally the patient gets into the OT. So this is a case of thoracoscopy. The patient is in prone position. This is just an indicative video wherein we want to show all our participants today that high-end surgeries, when the trainees are exposed, for them doing appendix, coli, hernias, and for example, total laparoscopic hysterectomies becomes little easier. This is azygous vein. Patient is lying down in a prone position. The lungs are here and the spine is above. We are ligating and clipping the azygous vein so that we can get exposure of the esophagus there. You can see pumping of the azygous vein there. And the esophagus is dissected circumferentially. We have retracted it with the umbilical tape. Now you can see that there is a tumor which is actually leiomyoma, which we had seen in the endoscopic ultrasound and also in the CT scan and also in the endoscopy. Now we are getting through it. Actually, the approach is taken through thoracoscopy on the right chest, and now you can see the whole of the tumor is almost coming out. So when we deliver such surgeries in front of those trainees who are in initial period of their training, they get motivated, they get transformed in their lives, and then they get inspiration that yes, if someone doing it, why can't we do that? So you can see that almost 4 centimeter to 3 centimeter tumor has been taken out, and we are now suturing the myotomy site at the esophagus. You can see the myotomy site has been sutured, and in this particular case, we made sure that we haven't opened the mucosa of the esophagus so that patient go home in a very early period. So what next? What is the target when we do training in an institute like Gateway Clinics? So we actually we give focus to all the trainees who are attending the program. We ask them to focus in the areas where they need most improvement. We ask them what exactly they want to learn. We ask them where exactly they are, missing in doing a quality laparoscopy or quality endoscopy. And that's how we start developing their skills according to their own feedback on the first training class, and which is useful slowly, to improve their professional life. And that's how we treat our trainees. This is another case of an elderly lady who presented with severe dyspnea, and she was diagnosed to have a large diaphragmatic hernia in the left hemidiaphragm, where you can see all the organs, stomach, transverse colon, small intestine were getting inside the left hemithorax. We have cleared all of them. The spleen is brought down, and lungs will now have, a chance to expand there. We have sutured the complete diaphragmatic hernia defect there with the continuous sutures. And in all those cases, we always put a composite mesh, which is on the two side. This side is being laid either by the monocryl, vicryl, or PTFE substances, which does not form any sort of adhesions when kept in the abdominal cavity, and we suture them. So when they get a knowledge of doing upper GI, colorectal surgeries, bariatric surgeries, difficult tumors like liver hepatectomies through laparoscopy, they have tendency to do the simpler cases like appendicectomy, cholecystectomies, hernia, TAPP and TEP repairs with little bit more ease. At an institution, we always give experience, first-hand experience with handling of the instrument, because we have laparoscopic endo trainers here. We have endoscopy endo trainer as well. So whenever last 2 times when we have done 2 courses, one with the laparoscopy and another one was with the endoscopy, with the help of Indian Medical Association's AMS part, with help of Rajesh Babu sir. So we always can give institutional training which allow networking opportunity. The students who attended last 2 courses, could get into our contact again and again. Like last week, we had conducted 2 days live conference, and almost all those trainees who had come to us through IMA AMS attended this conference. They all were allowed to, get watched in our operation theater, and that's how the learning continues. It is not just 6 months or 1 year of course, but they continue to have networking with us. And again, to the faculties whom we invite here from Mumbai, Calcutta, Delhi, for example, they have contacts at AIMS Delhi now, because the faculties were also invited from AIMS Delhi. And we have few trainees through IMA AMS who are continuing their laser training at Calcutta with Dr. Kalyankar with the help of Gateway Clinics. So that is another advantage of attending these kind of courses. Participants can meet a professional of our field. They can exchange ideas, they can discuss things with them, they can build relationships with them, and that benefits surely for the future, as I gave an example of last week. This is one last case scenario where I'm showing eventration of diaphragm, where patient was with the care of a pulmonologist for almost 6 months with the history of dyspnea, young fellow, known smoker, but a continuous history of dyspnea. And finally, he was referred by pulmonologist to us after doing a CT, where they found that the left hemidiaphragm of this particular patient was raised, and all the organs of abdominal cavity, including stomach, colon, small intestine, and spleen, were getting into the left thoracic cavity and compressing the left hemithorax and the left lungs, and that was leading to dyspnea in this young patient. He was aged just 29 years. So in this case, again, I just wanted to show this video as a sample to say that we are doing all these advanced cases at this particular institute. Now we are taking, you can see the heart beating just above. we are taking a careful bite on medial aspect of the left hemidiaphragm, and we continue to plicate. So this is basically a case of eventration of left hemidiaphragm, and our surgery being done is here is laparoscopic plication of diaphragmatic eventration with placement of a mesh and reinforcement with the mesh. So you can see these suturing skills are very, very important for those trainees who are trying to acquire their training in an institute like Gateway Clinic. And surely this is the way IMA AMS needs a big upload when they are trying so hard to pull all those trainees from rural India, trainees from places where they were not otherwise trained in quality laparoscopy and endoscopy to get themselves trained at very nominal cost. And we welcome them all. And I really thank IMA AMS Tamil Nadu and national office bearers for taking this particular step in favor of our trainees. So here we would give them hands-on training. We have faculties from all over the country. They will surely get a recognition from all of them. We have all the state-of-art facilities, laparoscope, endoscopes available with our hospital, and a networking opportunity, as I said, for them to develop their professional career. And surely that it would help them in shaping their better future. Thank you so much, all the office bearers of IMA AMS Tamil Nadu, IMA itself, and IMA AMS. Thank you so much, sir. Dr. Sendil, sir, and we are privileged to have this particular program with you. Thank you, sir.
Thank you, Dr. Padma, sir, for this wonderful highlight about the importance and need of the laparoscopy, endoscopy training in the institution. So we have a very great hospital, Gateway Clinics, with a lot of facilities, with stalwarts, your chief chairman, Dr. K. Sendil Kumar, sir. You are all well trained in Western world, and you are very eagerly to teach our IMA members to learn all about the fine tuning of the skills. So thank you very much for the wonderful facility. Definitely will utilize your services and all. So this is the first kind of thing this year we are starting in the year. First laparoscopy course in Gateway Clinic from June onwards. So similar to that, various courses we are planning to start our various hospitals. In Chennai, I am planning to start in MGM, Bilroth, and the Apollo Girishwari Hospital, and various places we are going to start the various kind of IMA AMS program, including my department. I am the pulmonologist in my department in the MGM. I'm going to start the program on interventional pulmonology, which consists of bronchoscopy and medical thoracoscopy and thoracic oncology, because well, lung cancer is one of the common cancer among the men and women in the Western world. And also I am planning to apply sleep medicine course module to the approval. So definitely another 2-3 months later, definitely we'll start our sleep medicine course, fellowship in sleep medicine 1-year course. So with this, a lot of courses, infertility and intensive care.
Sir, any questions from audience, sir?
Yes, sir. Please, sir. Yeah, questions from audience.
Any questions from audience?
Please go, sir.
Sir, Dr. Sundaramurthy here, pulmonologist, South Chennai.
Good evening. Welcome, sir.
Namaskaram, sir. Yeah, first question is how common you come across subcutaneous emphysema as a complication during the procedure, during and after?
Subcutaneous emphysema in
during and after.
After the surgery, yes, sir. What was that? Any experience about the subcutaneous surgical emphysema in a laparoscopic surgery?
During laparoscopy, yes, sir. So we keep our nurses very, very active so that the trocars does not get into the subcutaneous plane, which has CO2 connected, and the pneumoperitoneum does not get, instead of abdominal cavity, does not get into the subcutaneous plane. There are another scenarios like hernias, where we dissect the sac, pseudosac, and in those conditions, sometimes when the sac is excised and the layers of abdominal wall or the inguinal area is very thin, in those cases, subcutaneous emphysema may get into the wrong plane. And I think prevention is the key here. We should remember that they all are preventable aspects. And yes, usually if it is small subcutaneous emphysema, usually they resolve on their own.
So one more question can I ask, sir, regarding foreign body removal, organic and inorganic foreign body? What are the challenges you face during the removal of foreign body, especially organic foreign body?
Yes, sir. Like, I mean, foreign body is always a difficult situation to treat, whether it is in GI tract or whether it is outside, for example, skin or abdominal wall or chest wall or so on. Because finding an foreign body is difficult. In endoscopy, when we have foreign bodies like chicken pieces, mutton pieces, or fish bones, and sometimes batteries or the coins which are being, engulfed by the kids. So in those cases, usually that if they are quite big, the retrieval is little difficult. And in those cases where the foreign body is quite big, we tend to give them general anesthesia because the chances of aspiration is too high when the foreign body is being retrieved in the area of oropharynx. And the other foreign bodies like trichobezoar, obviously laparoscopy is a great help there, sir.
Thank you, sir. Well done, sir. God bless you. Thank you.
Thank you so much, sir. Thank you so much.
Any other question from any delegates? Please unmute yourself and can ask to the expertise like Dr. K. Sandilkumar and Dr. Patwa, sir.
So, Sendil, how many months you are going to conduct this course?
We are planning for 6 months.
Once in a month you will have the course, no?
Yeah, we will have a course.
So once people start joining, and we will start it. We will see the response. How many people are joining? We will start it. If they are joining, and people are joining, we will start straight away this month itself, or possible, or we will postpone to July 1st. So we will plan like that.
We got I mean, large number of previous training doctors in our list, so we'll spread the information to those people. And the IMA AMS, since IMA, it is the training is done under IMA AMS this one, so people will definitely be interested to join the teaching program. We are confident that we will be able to get 10 surgeons very soon.
So, what are all the procedures you are going to show them during the course?
During the course, we want to show the instrumentation, energy sources, the cleaning and sterilization of the instruments, the latest sterilization techniques. We will demonstrate suturing skill, because suturing skill is very important and it needs a lot of coordination, hand-eye coordination. Those things we will teach. And we'll show we have got plenty of video collection, all from starting from appendix to all major cancer surgeries, including cancer, esophagus, colorectal cancer, gastric cancer. So we have plenty of videos in our video library, so they will have access to all the videos, whatever the thing which they need to see, they can see the videos. And we'll in live surgery, starting from appendix to all major surgeries, whatever the cases which we are getting, we'll pool it during that day, and we'll demonstrate I mean, all the procedures inside the operation theater. So they can come inside the operation theater, they will join in the operation team one by one in rotation. So those things which we are planning for the course.
So any other questions from the delegates?
Unmute your mic and you can ask the question, sir, regarding the courses in IMA AMS or in the particularly Lapima, that is fellowship course in laparoscopy. There are various kinds of courses. You can ask any queries, how to start, whichever the queries you can ask. Our chairman Rajesh Babu sir is here, and you can feel free to ask any question. Thank you. All the delegates, and I thank you, the Gateway Clinic chairman, Dr. K. Sandilkumar sir, and senior consultant, Dr. Patwa sir, for the wonderful facilities and wonderful explanation about this fellowship course in laparoscopy. So congratulations, all the best. So definitely we'll do a lot of wonders like this course. So in Chennai and other metro cities also we'll be starting courses. I request all the IMA members kindly join in AMS, those who are having the PG qualifications like degree and diploma, and enroll in IMA AMS, and we'll be holding a periodical classes, workshop, and the master class, and also, and we have journal conferences. So next month, June 22nd, we have East Zone IMA AMS conference at Trichy IMA Hall, and in the month of August 4th, we are going to conduct the National IMA AMS South Zone Conference at Chennai. So I request everyone stay tuned and closely follow our WhatsApp and other social media messages. We'll communicate. Any queries, you please feel free to contact your branch president or secretary directly, me or our chairman Rajesh Babu sir and our joint secretary Sindhil Kumar sir. So with this, I thank you very much for this wonderful opportunity, and I best wishes for the Gateway Clinic director, chairman, and the consultants and the staff.
President sir, anything you want to tell, sir?
Thank you,
Sir.
Sendil, thank you very much, Sendil.
Sir, thank you, sir. We should thank you.
Sendil has been, in the past, he was our faculty in the lab course, the endoscopy course, and he has joined again, kind of IMA bandwagon. Let us do things particularly for the next generation. We all have that one agenda with us that we have to take care of the next generation. The one word I want to tell finally, remember that we don't want our next generation less than us. They should be more than us in all walks and all spheres in medical profession. That should be our idea. This is happening in all other professions, lawyers, bureaucrats, engineers, IPS officers, everywhere. But only thing is we have that kind of deficiency here in our profession. That is the thing we want to change. I have been personally working on that particular aspect, empowering people to take our next generation more than us, so that they can face all kinds of challenges, skills, knowledge, wisdom, everything. Everything should be more than us. So that should be our idea. So in that direction only, this course is organized by IMA AMS. I thank all the faculties of AMS and also Gateway Clinics for having this wonderful program today. It will go a long way, I know, that reach good heights, good developments, good achievements in this particular field. Thank you very much for the opportunity.
Thank you, President.
Thank you so much, sir.
Wonderful
Thank you.
comments
Thanks a
about
lot,
the
sir.
next
Thanks.
generation
Thank you,
above
sir.
us. This is a very important mantra. Taraka mantra definitely will follow, sir. Thank you very much, sir. Rajesh Babu, sir, any concluding remarks, sir?
Nothing.
Okay, so with that, if there are no questions, we can conclude this session. I thank you, Gateway Clinic Chairman, Dr. K. Sindhil Kumar, sir, and the Senior Consultant, Gateway Clinics, Dr. Patwa, sir, and all the delegates and our IMA leaders for this wonderful opportunity in this platform. I thank our IT Information Technology Chairman, Dr. J. Kumar, and Prabha ma'am, and Mr. Santosh from Coimbatore IMA, Dr. Karthik Professor Office. Thank you all. We'll meet again in the next meeting. So God bless you. Good evening to one and all. Thank you very much. Namaste.